Hello, my name is HeLa Cells, and today I will be talking about the ethical issues surrounding HeLa cells. HeLa cells are often called immortal cells because they can divide indefinitely under almost any condition. Scientists rely on these cells because, unlike most human cells, they can grow outside the body. This unique characteristic has led to major breakthroughs in medicine, but there is a deeper story behind them, one that raises serious ethical concerns. The name HeLa comes from Henrietta Lacks, an African American woman who wanted treatment for cervical cancer at Johns Hopkins Hospital in 1951. At that time, it was the only hospital that provided medical care to Black patients. During her treatment, Dr. George Gay took a sample of her tumor without informing her or obtaining her consent. He soon realized that her cells were different from others. They continued to grow and divide at an unprecedented rate. This discovery was groundbreaking for science, but there was a major problem. Henrietta never knew that this was happening. She died on October 4th, 1951, not knowing that her cells has been harvested, shared, and used in international research. Her cells were then shared with scientists around the world, fueling decades of research, all without her or her family's knowledge. It wasn't until 1973, more than 2 decades after her death, that her family learned about HeLa cells. They were contacted by researchers who wanted their blood samples, but even then, the story wasn't fully explained to them. For years, Henrietta's family received no recognition, no compensation, and no explanation. This lack of transparency created distrust between the Lacks family and the medical community, a problem that still affects marginalized communities today. The biggest ethical issue in this case is the violation of informed consent. Henrietta Lacks was never told about her cells being used for scientific research, meaning that she was denied the right to make decisions about her own body. While laws at that time did not require consent for tissue samples, it does not make it ethically acceptable. The situation became even more controversial when HeLa cells were widely commercialized, leading to billions of dollars in profits for biotech companies, while Henrietta's family remained unaware and received nothing. Despite the ethical failures of the past, Henrietta's story has had a lasting impact on medical ethics. Her case had led a stronger protection for patients, including informed consent laws, requiring individuals to explicitly agree before their tissues can be used in research. A greater transparency in medical studies. This ensures that people understand how their biological materials will be used, and ongoing discussions whether families should be compensated when their loved ones contribute to profitable discoveries. Despite the controversies, as mentioned before, HeLa cells have contributed to life-saving breakthroughs. This includes the polio vaccine, the HPV research, cancer treatments, and even COVID-19 vaccines. Henrietta Lacks unknowingly changed the world. Her case serves as a critical lesson in bioethics, reminding us the importance of respect, transparency, and patient rights in medical research. It is important, as dental hygienists, we should know about the unethical practices that takes place in a healthcare setting. As we work closely with patients, unethical actions can harm our patient. We should maintain integrity and be truthful, as this will impact our careers and the patient's future. Learning about these ethical issues can certainly help with our decision-making skills, and critically think about what actions to take when faced with a dilemma. To conclude, we owe it to Henrietta Lacks and countless of others to build a system that values both scientific discovery and human dignity. Thank you.